Hello, my name is Joyce Umuhire, and I am here to discuss about what should we do or some ethical guidelines that should and must guide us during different work or organization we are in. So today we are going to look together the ethical guidelines for managers at Stronger Memorial Hospital, the analysis of the three sample cases concerning ethical guidelines, the appropriate action plan for the three cases, feedback, and one example of the manager's response on the feedback, and finally references. Let's look together some ethical guidelines for the managers at Stronger Memorial Hospital. So when we say ethics, we mean the standards or behaviors that tells us how human like children, professionals, teachers, and others are behaving in various situations they might find themselves. So the two basic problems in identifying ethical standards are: one is on what do you base on, or what do we base on when we are dealing with ethical standards, and how do those standards be applied. So some of the guidelines we're going to talk today at the Stronger Memorial Hospital can be used. They include the use of utilitarian approach, which is the ethical approach that produces greatest balance of good over harm. Use of rights approach. This is all about respecting moral rights of individuals, of those affected, and the use of fairness or justice, about treating individuals equally, avoiding any unfairness, and the use of common good approach, which is the engagement for relationships of the society, and in ethical reasoning. Also, uh, we're going to look together the use of virtual approach, which is the virtual approach provides full development for our humanity. Like it enables us to act accordingly to the highest potential of our character, like being honest, being courageous, love, and others. So putting approaches together, each approach helps in determining the standard behavior to be considered ethically. So after ethical approaches, analysis, accurate decisions should be made based on, first of all, recognizing the ethical issue. What is the problem? What is the issue all about? Getting the facts. For instance, what are the other evidence that are relevant to the same issue? Evaluating alternative actions. What can be done in that case? And finally, making a decision and testing it before applying it. We have been given to analyze the three sample cases concerning the ethical guidelines, and one ethical issue is identifying about the issue of a heart transplant. So this case is an ethical issue concerning two people who are in need of a heart transplant services. One is an old man who is known in the community and is 53 years old, and another one is a new woman of 33 years old with a 10-year-old daughter. They are all in need of a heart transplant. So the ethical issue is who should be given the heart transplant. Another second issue is identifying the donation. The hospital has been given a donation, and they are dealing, or they have an issue on where to use the donation effectively. They want the staff is suggesting to use it in opening or building a new cosmetic surgery unit, yet they have a problem of pediatric wing, which is small, and the society or the community has new young family and they need it. So the ethical issue is where should the donation be directed to or used to. The third ethical issue or case is identifying the direct resources. So there is the old ill people in the hospital and the young people that need to be checked up and be paid attention. So, and the hospital is in short of resources, so they want to know where to direct the resources exactly. Should they be directed to the young patients or elderly ill patients? So those are the three sample cases concerning ethical issues and they need solutions. So for the three ethical issues, these are the appropriate action for them. First of all, heart transplant ethical case issue. If you base on the third approach, which is justice or use of fairness, which say that people are equal and should receive equal services, which means that the strong memorial hospital should increase resources to equalize patients. Both the old man and the newly lady in the community should all receive the transplant. So these are the action plans. First of all, they have to understand the issue. Secondly, use ethical guidelines like common good approach before making decision, and evaluate the possible initiative on buying sufficient resources to help both patients to avoid unfairness. Let's continue with the appropriate action plan for the ethical issues talked about. Moving on the nation case issue, this case shows that there is a pressure to attract more patients, and yet the hospital is surrounded by families and many people who have no insurance. And also, the administration need to increase pediatric week. So the action plan is the administration need to evaluate the guideline to be used, meaning that the utilitarian approach can be used here, producing the greatest balanced good over harm. And by evaluating the benefits of the staff idea of establishing a cosmetic surgery over expanding a pediatric wing. So if they can weigh the two options, either one is appropriate. So they have to go, they in making a decision they have to go on what is good than the other, or balancing good over harm. Let's look together on the last case of directing resources case issue. So in this issue, the administration has to use approaches like common good approach. So this approach is good for virtue and values like integrity, love, and fidelity. So the best way to approach this case is to find a way to serve both sides, not ill people or old over the young, but both, which means that they have to choose something that is going to not be like unequally or be unfair. By that, they have to look for a way they can expand their resources in order to satisfy both sides, not satisfying the old ill over the young patients or young patients over the old ill. Let's look together the suggested feedback time. So these are the few questions we would like to ask some managers to test about how they think about the web page. First of all, amongst the ethical guidelines on the web page, which one serves the most useful and which one is important? Secondly is which one is the least important, meaning why is it not important and why? So the third question is, do you think it is fair to provide equally services to both rich and poor? And which moral guidelines best fits for healthcare institutions according to you? Like which one is the best should be used in hospitals or healthcare organizations according to you? And is it ethical for healthcare providers to be guided by characters like guided by love, courage, or even honest? And if there is any suggestion to improve on or change the guidelines for better use, it is better to ask for it and seek for the advice. Let's look together the example of a manager's response on the feedback. Uh, First of all, you say that is really appreciative of the effort uh, on this web page, and he's saying that all approaches have most useful and important, but basically the utilitarian and justice. So there was no least important approach he ever seen, and they're all helpful accordingly because they all work hand in hand to provide the best services for the customers or patients. So the next question was if it was ethical for people to have equal rights or equal services. So he's saying that it is ethical to serve each person equally with no discrimination, either when you're rich or poor. Any person, there should be equal services or equal rights to one of them. Um, on the guidelines, he said that all guidelines work hand in hand. There is no guideline that is best for the hospital or healthcare organization because they all work hand in hand to provide better services for the patient. So as a manager, he faced a lot of cases and found that they are all applicable accordingly. And he said that it's very ethical to use virtual approaches like being guided by love, honest, or even courage, which means that for instance, if let me say a hospital manager or hospital provider or a doctor is welcoming people and they are working according to the numbers. So if a parent or a relative comes in, there is no way to first serve that person. There will be an equal way of providing services according to the numbers, basically, that is honest, and it's a way of providing service not basing on the connection or relatives that they have. Finally, he said that the page was helpful because it is easy to navigate and understand, and there are no suggestions. Everything looks perfect on the web page and easy to use. So Mark is thankful, and that's all. So this is the end of the web page. For more information, you can refer to the following resources. Thank you.